Dr. John Torres with NBC News, and this is Facebook Live. Thanks for joining us. I want to give you a coronavirus update and then answer some questions. So if you have any questions, please write them to us, and we'll try and get to as many of those as we can, because we're still in the midst of this pandemic around the world, and it's particularly hitting the United States right now. There are some countries that are hot spots. Italy is still having a lot of issues. Spain is having issues. Looks like it might be moving to England as well. But the U.S. seems to be one of the big hot spots. New York in particular, and New York City, they're calling that the epicenter of the outbreak here in the United States. And that's because there are so many cases. Part of the reason it's such a congested area. One of the issues you've probably heard a lot about are ventilators, and how we need more ventilators because we think we're going to have more patients that are going to need to be placed on those ventilators. You've probably heard the words go back and forth, respirator and ventilator. So let me clear that up first. A respirator are the devices that healthcare workers use to try and stop from catching coronavirus. So it can be that N95 mask, or it can be a full-blown respirator, which almost looks like scuba gear, where they basically have that on there with some oxygen tanks. That's for what we call airborne precautions. Those are things like measles and other diseases that can spread through the air very easily. This is more of a droplet precaution, meaning that somebody has to cough or sneeze, and so you don't necessarily need that heavy duty of a protection, but having some of those respirators is important. So those are respirators. Ventilators, on the other hand, are what we use to help patients who are having a hard time breathing and can't get that oxygen level they need to keep alive and keep their organs functioning. Usually a ventilator, what we end up doing is putting somebody, we intubate them. So we put them to sleep where they're not moving, we put a tube into their lungs, and then hook that up to a machine that breathes for them. They're usually on that for days, possibly weeks. In coronavirus, it seems like it's extending more towards those weeks. So that's part of the problem. People are on ventilators for a while, so they're taking that ventilator up, and there aren't that many ventilators around here, so we need more right now. And a lot of companies are stepping up and saying, hey, we're a car manufacturer, we're not manufacturing cars a lot right now, let's go ahead and get these ventilators out there. The government is pushing out some ventilators as well. So it looks like we're getting more of those out there, which is important. But on top of that, we need the people who can actually operate those ventilators as well. Those are respiratory therapists. And so a shout out to them. They're doing a fantastic job. We only have so many respiratory therapists, and so that's going to be a bit of a bottleneck as well, trying to figure that out, how we're going to deal around that. So that's the ventilator issue we're talking about. The other thing you might have heard about in the news recently is something called convalescent plasma. So I'm going to explain what that is. When somebody is sick with coronavirus, they build up antibodies. When they recover, those antibodies are still in their body. So if scientists take that blood, they process it down, they can pull out the antibodies, they can give that plasma or serum to a patient who is now suffering from coronavirus. They'll get that boost of antibodies that can fight coronavirus, and that'll hopefully help get them over the hump over the next week or two to get them better, where their body can better fight off coronavirus. Now, this is not a cure for the disease. This is a temporary measure to get them to the point where they can more successfully fight off the virus. What we're looking at are three different things we can use, different categories. Right now, the convalescent plasma we're talking about, that's short term. The FDA just announced that they're going to allow doctors to use it on a case-by-case basis across the country for seriously or critically ill patients only. They're looking to FDA approval, not there with that yet. The next step are the medicines, 3 to 4 months out before they get FDA approval. And then the final step is the vaccine, probably 12 to 18 months before that gets approval. So right now, very short term, convalescent plasma can be used for some people. We don't want to use it for everybody, especially people that have minor symptoms, because it's possible that it could actually backfire a little bit and cause people to be more likely to catch coronavirus and have consequences because of it. So we're very careful in who can use it, and these are the people that really need it because their body's having a hard time fighting it off. For the rest of us, doing the things we always know about. You're keeping your hands clean. Don't touch your face until you wash your hands. That social distancing, extra important to flatten that curve we talk about and make sure that we get out of this as soon as we can. Now, let me see if we have any questions here, because I know viewers oftentimes have a lot of really, really great questions.
Are chiropractors considered essential services?
So are chiropractors considered essential services? The answer is no, because what we're talking about are things that you need right now. Over the next 24 to 48 hours, you can't do without. You have to actually get that. We're talking about canceling essential or non-essential surgeries, elective surgeries. We're talking about not having visits to the hospital or doctor unless it's essential. In other words, if you miss it, it's going to cause consequences to your health. With chiropractors, any of the dentists, those types of things, even your regular doctor, if you don't need to go to a visit because you can postpone that, it's a better idea to postpone it right now. We're trying to make sure that social distancing is in practice because that's what's going to keep us all safe and bring this more and more under control. Any other questions?
Yes, how hard is it to recover from having the ventilator on?
So the question is, how hard is it to recover from having a ventilator on? And that's a fantastic question. It depends on a couple of things. It depends on how damaged your lungs get. And we know that coronavirus can damage your lungs. It can cause what's called fibrosis, which is essentially a scarring of the lung tissue. The more fibrosis you have, the harder time you're going to have breathing, and it's going to be harder to come off that ventilator. And oftentimes, we'll take people off the ventilator, find out they're not doing very well, and have to put them back on the ventilator, give them a little more time to let their lungs heal. For a lot of people, though, if they're on the ventilator short term, just a day or two to get that oxygen level up and to start feeling better, it's easier to come off, and they usually come off relatively quickly. So it depends on how deeply this coronavirus affects them as to how soon they might be able to come off of it.
Several people have asked if it's in the air. That's the concern that they're having now.
So people are asking if coronavirus is in the air, and this might be from a study you heard about where they said coronavirus can last a couple hours in the air. Let me tell you, this study was done in a very artificial setting. It was done with a nebulizer, what's called a drum, so it keeps pushing the virus up into the air. And when they did that, it was able to stay in the air for a couple of hours. In nature, where we're walking around coughing and sneezing, that virus cannot stay up in the air for that long of a period. It's very heavy in those mucus droplets that you get when you cough and sneeze, and so it falls to the ground very quickly. It is the type of situation that might happen inside an ICU where the patient's actually on a ventilator and are getting nebulized or other types of treatments. It might aerosolize that. If it does, then they're going to have issues with that. And so they want to make sure that healthcare providers are aware of that. But for the rest of us, not that big of a deal.
If I have a cough but no fever, am I still contagious?
So the question is, if I have a cough but no fever, and we'll leave this as the last question, if I have a cough but no fever, am I still contagious? Yes. Anytime you have symptoms, if you have coronavirus, if you're COVID-19 positive and you still have symptoms, then you're still contagious. And what the CDC is saying is the way you can tell you're not contagious and you can come out of isolation are two different things. One is you test negative 24 hours apart twice. So you have two different tests, 24 hours apart. They're both negative. Then you can come out of isolation. If you don't have access to those tests, because we still do have some testing issues, then what they say is you can go off of symptoms. So if you've had the symptoms for 7 days and the symptoms have gone away, then you need to wait 3 more days, 72 hours, to make sure you're fever-free. And if you're fever-free for that 72 hours, then you can go ahead and leave. So there's two ways, testing or based off symptoms that you're no longer contagious. And so that's the thing to think about. If you were never tested, then you essentially need to wait until you end up recovering from whatever symptoms you have. And then I'd go that 72 hours as well. Make sure you're fever-free for 72 hours before you can consider yourself not contagious anymore. So again, the main thing to remember, all of us, is we're in the midst of this right now. As the Surgeon General said, it's going to get bad this week. We're probably going to get worse than we thought we were going to get, but it's going to get better very quickly, hopefully. But that means that all of us need to do what we have to do in order to protect ourselves, our families, and our communities. And that basically means washing our hands, not touching our face, and especially that social distancing. So please help everybody out and make sure you practice all that. Thanks for watching Facebook Live, and I hope you have a very healthy and safe day.